A probiotic is the right bacteria in the right place at the right time. And a pathogen is the wrong bacteria in the wrong place at the wrong time.
Welcome to the Learn Skin podcast with me, Dr. Raja.
And me, Dr. Hadar, where we discuss all things skin.
Join us as we delve into the art and science of skin health in today's episode.
Hey, Raja, can you say the thing I told you to tell them?
Of course. We are board-certified dermatologists. This podcast is meant for educational and informational purposes only and is not considered medical advice, nor does it serve as a substitute for professional care by a doctor or other qualified medical professional. All opinions shared do not express the views of Learn Health, Inc. Let's get to the good stuff.
Hey, Raja, how are you today?
Hey, Hadar, how are things going? I'm feeling a little bit microcystic today. What about you?
I don't know. I feel like I want to talk about all these critters. We have all these little things around us, viruses, fungi, bacteria. And I really think that they are pertinent, not just to our disease, but also to our well-being. And so I think we want to attack it today maybe from a different angle. We talked a lot about gut and skin microbiome, but there's one place where they connect, and that's the oral mucosa, if you will, or our mouth. And so we need someone who's been around mouths for their career. What do you think?
Yeah, and good news. We have someone just to fit that bill. So today we have Mark Cannon, who's a professor of otolaryngology in the Division of Dentistry at Northwestern University, the Feinberg School of Medicine. He's an attending physician at Anne and Robert Lurie Children's Hospital and a member of the International Association of Pediatric Dentistry. And a fun little fact, he's also a very proud grandfather. That's a sidebar, but of course, that's the spice of life. And Mark, we are so excited to have you on this podcast.
Well, I'm really excited to be on the podcast. I hope we have a good conversation. I wouldn't want to blemish your career.
Absolutely.
Sorry.
Yeah, no, that's right.
You know what? It's funny. We were just talking about how sometimes cuss words and whatnot can be used in podcasts to really spice it up. Well, maybe we can just talk a little bit about what's found in crap today, and what we need to know about it.
Yeah.
Absolutely.
But the crap has to get there through going through the mouth first. I mean, there is
this is getting good.
There's
an entry already.
Yeah.
Just like all good specialists, you got to root for your specialty. I admire that. Thank you for doing that. Absolutely. Yeah, no, absolutely. So I think what we wanted to start talking about, first of all, is we all know about the microbiome. I think everybody who has listened to us for a minute knows that we understand that there are small critters around us, bacteria, fungi, viruses, and they make up some stuff that's inside of us and around us. But also something that is maybe less commonly spoken about is the concept of biofilms and how those structures lead and support, in a way, systemic disease. And so maybe we can start there, Mark. Maybe you can explain to us what are biofilms, what are their kind of basic properties, and why should we care about them?
Well, everything is kind of related. I had mentioned that, that's a principle of Darwin, that all life is related and all life is connected. So when you look at the biofilm, there are certain pathogens like in the oral cavity, Streptococcus mutans, another one of those streps, that is not pathogenic unless it's around Candida albicans. So you have to have the Candida albicans first for that pathogenicity of the strep mutans to work. So strong is that connection that if you look at children who get severe oral disease, early childhood caries, it's the mother who has the Candida albicans giving it to the child that later sets up everything that happens with that oral disease. And the oral disease is very important because you only get oral disease like caries, decay, and periodontal disease if you're missing something very important in the mouth, the nitrate-reducing bacteria. If you're missing the nitrate-reducing bacteria, just like the American Heart Association came out in December of 2019, you're set up for heart disease because it's your nitrate-reducing bacteria that produce nitric oxide. The nitric oxide is what lowers your blood pressure, encourages capillary repair, and even repair cardiac tissue post-hypoxia. So, yeah, all this is all connected. So it's often not what you have in the biofilm, It's what you're missing in the biofilm that is important.
Yeah, and it is fascinating how we learn more and more about those relationships, right? Because I explain to my patients that a biofilm is like a neighborhood of bacteria. Sometimes it's all bacteria that are, the same kind of family. Sometimes they connect with other family, what we call polymicrobial, and they all kind of sit together. And if they feel some antibiotic is coming, they are all starting to go into this lower metabolic rate, meaning that they're not so hungry anymore. They kind of sit down and say, we're not going to eat any of that antibiotics, so we're not going to get sick and die. And then they secrete all this protective layer around them and they just sit there. And we see this a lot in diseases where we treat with antibiotics. And then we call it, maybe the antibiotic has this anti-inflammatory, quote unquote, effect. And then the moment the antibiotics is gone, boom, the disease comes back right away, and sometimes even stronger. And when I see that a lot in wounds. I treat a lot of patients who have chronic wounds that don't want to heal, as if their skin cells are sick for some reason. Maybe it's the biofilm that's there that's changing them and not allowing them to heal. I think we see this in the disease called hidradenitis suppurativa, which exactly fills that bill, right? You treat it with antibiotics, it doesn't seem to be there anymore, and all of a sudden, boom, it comes back. Can you talk about some of the biofilms that we see maybe in systemic disease from your neck of the woods and how that relationship plays?
Oh, the neck and the head of the woods, I would say, probably.
Yes, exactly.
There's a couple things you mentioned which are very, very pertinent. One is the matrix, the extracellular matrix composed of all these polysaccharides. That will protect, but also change the environment. It allows for an acidic environment that some of the pathogens greatly prefer, and it does protect them from antimicrobials. But it also gets rid of the friendly ones. Now, you have a lot of good bacteria that usually coexist with us, like the commensals from Commensals sharing the table. So when we look at people, we're like a cruise ship, as you know. We're a cruise ship. We have passengers who are the commensals who are with us for the ride. If we die, they die. They eat what we eat, basically. And then you have the crew, and those are the probiotics. They're there to help us and guide us. So we couldn't survive without our crew, which are the probiotics. And they moderate that extracellular matrix. There's a lot of good bacteria, often in the same family. Like if you want to inhibit strep mutans, use strep borealis. If you want to inhibit strep pyogenes, you use strep salivarius. They often will inhibit staph aureus. You can displace that with staph epidermidis, as you guys know. And if everyone's in the right place, then everything works perfectly fine. Sometimes things get in the wrong place. Staph epidermidis, as you know, can go down into the dermis and inhabit within fibroblasts, and also actually within osteoblasts too, which is even more interesting. So just a few days ago, I was talking to an orthopedic surgeon about wound infections. And the fact that, as they were saying, we are in the operating room, we scrub that skin so clean, we do everything, but yet we still can get some wound infections. And it's because bacteria go within our cells all the time. They go intracellularly within our cells.
Yeah, no, absolutely. And that's a fascinating thing that I learned, because I always thought about it since medical school, or even before that, that it's viruses that go inside the cells. But now we clearly know and can demonstrate it, that there are certain bacteria, staph for sure loves to do this in wounds, kind of go and hide inside the cell. So it's not just that biofilm phenomena, it's also the hide and go seek that these bacteria play with us as we try to improve health. And you mentioned this concept of location and that relationship. Can you expand about it? Is it possible that one bacteria could be good in one place and then not so good, or a disease harboring in another place? I know that we are learning more and more about staph epidermidis, for example, who we always thought of as just an innocent bystander or a commensal, as you mentioned. But now we're getting these results in cultures of skin infections that show staph epidermidis who is developing even drug resistance. So very early, of course, but can you talk about that relationship of the right bacteria in the wrong location, or the the wrong bacteria in
Yeah.
the right location?
Well, that's always been my joke. And a probiotic is the right bacteria in the right place at the right time. And a pathogen is the wrong bacteria in the wrong place at the wrong time. Because you can take a probiotic, Lactobacillus rhamnosus, and if you put it in the lungs, you're going to have someone who has exercise-induced asthma. if you put it, within the brain, or have a bacterial encephalitis. It's just they aren't supposed to be certain places at certain times. And as we know, during like pregnancy, the vaginal microbiome changes significantly during pregnancy. It loses lots of diversity, but the number of lactobacilli go up, especially Lactobacilli johnsoni, which is a very important probiotic. So we see these changes occur. As you know, your microbiome changes with age, just like your gut microbiome. So what we can have going on is a horrible combination of wrong time, wrong bacteria, wrong situation, where you can get what normally would be a commensal being a pathogen. And some of us think that a lot of our pathogens are actually pathobionts. They were actually at one time were commensals, but they have actually strain shifted. And that's one thing I know we have to talk about, is the importance of strains. Because when you look at staph
Yes.
epidermidis, it's certain strains. Now, we deal with an extremophile in dentistry. And there's only a handful of extremophiles. I mean, Helicobacter pylori and Porphyromonas gingivalis.
Can you explain what are extremophiles, just so we are on the same page?
Extremophiles are bacteria that can live in many different areas, and they
Got
completely
it.
destroy the concept of tropism. I mean, in many ways, I think tropism is good for plants, but really bad in microbiology.
Got it.
You know,
Excellent. Thank
it
you.
really is. I mean, even when we talk about a lot of commensals, they can strain shift. They may not be a commensal. And some of the pathogens are pathogens, but they're less pathogens than other pathogens. So just think about the first virus probiotic ever done. The first viral probiotic. Edward Jenner's, right? Giving cowpox to that 8-year-old boy to test against smallpox.
Right.
Now we know it wasn't actually probably cowpox, it was probably horsepox that the milkmaid had on her hands. But anyway, it's less of a pathogen, therefore it was a probiotic. But I always say, how old are probiotics? Oh, well, cowpox was a probiotic because it prevented
Right.
more severe disease. But
And,
when we look at extremophiles, we got to talk about Porphyromonas gingivalis. Now, Porphyromonas gingivalis has 6 strains, 2 of which are extremely virulent. And I'm sure you've read this many places, that Porphyromonas gingivalis has been associated with not just periodontal disease, but atherosclerosis, metabolic syndrome, colitis, arthritis, many
right.
different things. And they actually have the whole mechanism worked out with Porphyromonas gingivalis, because it is considered the ultimate gorilla bacterium. It enters within your epithelial cells, not just gingival epithelial cells, but can also enter into endothelial cells to help create the atherosclerosis. It actually breaks down the blood-brain barrier so that immune cells cannot get in, they're blocked, but the gingipanes from Porphyromonas gingivalis will get in, causes massive inflammation, therefore you get the beta amyloid plaque and the tau protein depositions, and yet the immune cells cannot get in to clean it out. That's why you don't find a lot of PG cells in there. But PG is so extreme that in animal studies, when they do an oral lavage of Porphyromonas gingivalis once in these mice studies, just once, it actually causes the leaky gut syndrome. It actually causes a breakdown, and a whole bunch of enterobacterium go into the bloodstream, and they actually get into the liver and other parts of the body. It is just totally amazing, because it
Wow.
enters into your epithelial cells. It shuts down your tight junctions. You lose your tight junctions, everything leaks. And a lot of what leaks in are commensals, but they still cause damage because they're not supposed to be there. It then migrates and forms these little vacuoles full of PG close to the mitochondria, very close to mitochondria. It seems to hijack some of the ATP, and it puts the cell into senescence. So apoptosis is turned off, and with the cell being in senescence, then it can continue to proliferate, and the cells don't die. They just start to pile up. So people with chronic gum disease will have these like swollen gums, and everyone always assumed it was due to edema and inflammation. And yeah, Porphyromonas gingivalis will tell macrophages to release nitric oxide, which is important because it needs the blood supply coming to the area. It basically hijacks your body.
That's fascinating because a lot of what you said sound very similar in various skin diseases that we see. For example, in atopic dermatitis, how Staph aureus changes the skin and its ability to handle the transepidermal water loss, or what we see in wound healing when we have the skin cells, instead of migrating across to heal the wound, kind of piling up. Right. And this sounds very similar to what's happening in the gingiva. I wanted to ask
Yeah,
you.
actually, no kidding, Hadar. Before you go on to that question, I just want to make a comment. Maybe, I might slide a question into here just before you ask yours, because if we're talking about how it's shifting the cells and whatnot, Mark, are we doing a lot of studies on the epigenetic changes that a bacteria might do just through surface contact, or like through, because, people think about, like, for example, probiotics have to be alive to have an effect, but we know that's not true. You can have surface contact that can do all kinds of changes. Are we looking at those epigenetic changes? Because that probably is more important than just what your genes have.
Oh yeah, in fact, they change themselves. The Porphyromonas gingivalis shuts down a lot of its own virulence to live within the cell. Remember, a dead host did not propagate the pathogen. It doesn't want you to die. It wants you to continue to live, carry it. It's a perfect parasite. It's interesting. It does make you sick, makes you less capable of actually taking care of yourself, which is one of the funny things about Alzheimer's with it, inflammatory Alzheimer's with it. But if you can look at any journal on Alzheimer's right now, you'll see them talking about inflammatory Alzheimer's and gingivalis from Porphyromonas gingivalis. That thing is an extremophile. It is so involved with so many diseases, including even acne, because it causes a leaky gut. And as you know from, I'm sure you've talked about this on your podcast, there's a number of studies showing a distinct gut microbiome with acne. And psoriasis, we cannot forget psoriasis. But again, it's the same mechanism. Every time you look at these pathogens, whether it's Porphyromonas gingivalis or others, you always see the beta-1 integrin receptor pop up all the time. You always see fibronectin coming up. And then Porphyromonas gingivalis will actually have fibronectin bridges go between the epithelial cells, so it can transfer itself between cell and cell without even going outside the cell. It's like being in Minneapolis and staying on the skywalk and not being exposed to winter. I mean, this is some really interesting evolution for a pathogen that's only been in us about, where they estimate 35,000 years. Porphyromonas gingivalis, before that it was a commensal. Interesting evolution last 35,000 years.
And I wanted to touch about this actually because you mentioned this strange shift, and it brings up this maybe romantic idea. Maybe I am a romantic after all, you tell me. But what have we done to our bacteria to really piss them off so much that they become so pathogenic to us over the years? Is it something that we are doing to them? Because understanding these pathologies in a way can definitely lead us to maybe re-engaging these strains and bring them back into balance, or making them part of our dining table, sitting with us as commensals.
Yeah, that's so perfectly stated. There's a beautiful paper done by a graduate student out of University of Washington, and she had done this long-term study on doing what was considered epitome of preventive dental care. And what she found at the end, that the pathogens she were looking at had strain shifted to be actually more virulent, significantly more virulent and more acid producing than they were at the beginning before they started to do all their preventive care. When we use antimicrobials, we're weeding away the weak and letting the bad grow better. And don't forget, they have a new generation every couple hours. So it's kind of like what happens with a lot of oncology treatments, where at first the tumor shrinks because you kill all the weak cancer cells and the rest survive and come back. So yeah, it's very similar. So what we have to do is get back to using bacteria to fight bacteria. We need to get back to restoring our natural biofilms. I have a funny story you guys will appreciate, I hope.
Well, Mark, can I just make a comment right on that? You know, when they say antibiotics kill 99.99%, it's like there's still a ton of bacteria left over, right? After that could be like the resistant ones unless you have a second way of like affecting the balance and stuff. But sorry, I want to hear your funny story.
No. I was talking to some of the dermatology fellow and a couple of residents at Northwestern about like 10 years ago. I made the comment, I said, well, it just helps a lot with skin if people use a good soap. By that, I meant something that's not really bad for your skin. And the fellow laughed, saying, when we tell people good soap, they think in terms of buying a brick of Irish Spring at Costco. I thought that was hysterical.
Yeah, no, it's definitely our understanding of how to care for the skin and what kind of detergents to use on it or not has definitely evolved over the years. But I find myself in clinic again and again having to tell people that, you don't have to scrub every square inch of your skin every day. The example I give is that most people can't reach the middle of their back, but yet I have not seen a lot of horns coming out of backs when I walk down the street. So I figure it's still okay not to really, really scrub it. So anyways, I think there's a point there, and the idea of trying to restore that balance. And I like the example you gave with that graduate student. And I'm wondering, are these principles right now being leveraged in clinical trials, or is there any active research that's being done on kind of restoring that? You alluded a little bit to Alzheimer's disease and kind of the neurology field. Are you aware of any studies that are being done or any ways that we leverage this therapeutically?
Restoring the microbiome, we have fallen so far behind Europe. They are doing so many things right now with fecal matter transplants that are just totally mind-blowing. I did a presentation at the Rome Probiotic, Prebiotic, and Nutraceutical Symposium about 6 weeks ago. And put it in perspective, there was a presentation on 21 clinical trials using fecal matter transplant for neurological issues. And all of them were very beneficial for OCD, anxiety, depression. And you guys know how for the last 70 years, there's been concepts that acne could be associated with anxiety, depression. And I have to tell you, I see these teenagers come in, severe gingival disease, like we mentioned before, just one treatment with Porphyromonas gingivalis can cause a leaky gut. They come in, they have a bad diet, they can't eat a bunch of food, they have acne, terrible gingival disease, they have issues with attention deficit and hyperactivity, they have all sorts of things going on in their health history, mainly anxiety though. And we do know from the studies that have been done with probiotics and anxiety that, in fact, there's some good studies I'm sure you're aware of with probiotics in skin for acne. And the biggest thing I like are the studies with prebiotics in skin, because xylitol is a phenomenal prebiotic. It's a crazy story.
It's also more stable, because I feel like you can put it into actual formulations a little better with prebiotics or
Oh, yeah.
postbiotics.
It's a wonderful prebiotic. And can I tell you a little secret that most people don't know? Vitamin C
Please.
breaks down into D-xylose and xylitol.
Well, there you
D-xylose
go.
and xylose is the most common carbohydrate in nature. And D-xylose is the point where heparan sulfate attaches to your core protein on your cell membrane. So we talk about before the beta-1 integrin receptor as being one of these things that pops up all the time. Well, you cannot get to that receptor, which, by the way, gives all these communications. It's how all the cells communicate back and forth. And that's what gets wrong with like psoriasis. You got this, receptor going crazy too. But you can't get to it if heparan sulfate is maintained in the core protein. So most of these pathogens actually go and they try to knock off the heparan sulfate on the core protein right there on the cell membrane to get to the beta-1 integrin receptor. So it's interesting that they have to do that before they can internalize. Many viruses use the exact same mechanism. H1N1 uses the exact same mechanism. Human respiratory syncytial virus, you can look this all up. They use the same mechanism because they evolved that way. And with nature, as you guys know, if it works, it works. Nature doesn't go, let's have plan B, plan C, plan D. It just
Right.
picks something, it works, and it works because we're all interrelated. We have all these shared proteins, viruses, and bacteria and humans.
Yeah, absolutely, Mark. You mentioned kind of in passing fecal matter transplant. And before we have our audience kind of going to their septic tanks and starting to bathe, could you explain what that means and what's the kind of overall hypothesis of how these interventions may work?
Well, in Europe, they use universal donors. So they find people who are very healthy in their 20s and 30s, healthy diet, they work out, no disease. They test the fecal matter anyway, because that's like a giant probiotic plug for you. They test it for all the pathogens, H1N1, of course, HIV and SARS-CoV-2. They test for all that, hepatitis. And there's a couple ways they can do it. They can just, deliver it rectally. There have been studies where they've had people swallow a tube to bring it down. And there are, of course, capsules are made out of it, like Sweden has a bunch of capsules. But what happens is most people, if you give them a good, healthy microbiome, they perform better in everything. Neurologically, they're much better because your neurotransmitters come from your gut. In fact, as you know, there was a famous study done by Phil Standrick where they looked at the bacteria that was breaking down your GABA. Gamma-aminobutyric acid is your precursor for all your neurotransmitters. And they actually found the bacteria that was breaking down the GABA in people who are depressed, and they confirmed it actually with PET scans and all the clinical diagnosis that if you're depressed, you are missing neurotransmitters. That's why they give you neurotransmitters, right? That's why you take your sustained serotonin reuptake inhibitors, to keep you happy, keep the serotonin levels up.
Right.
Now, fecal matter transplant has also been used in the United States to help with symptoms and of gastric symptoms and autism. And the people down at the University of Arizona, Dr. James Adams and others have got a beautiful paper out there. Very significant changes in autism, very significant changes in the learning, the behavior, and also in their gut by doing a fecal matter transplant. But we are behind. Right. During COVID-19, they shut down the FMTs here because they're worried about COVID-19, but in Europe, they continue to do it because it simply tested the fecal matter for SARS-CoV-2. The other thing is they use universal donors. Here we try to use relatives. Really bad idea. There's no concept. I mean, there's no rationale for thinking that your brother's or your father's or your mother's poop is better than someone who's really in great shape. Because don't forget, athletes have a different microbiome.
Right. And so the question is the hypothesis there or the mechanism is that fecal matter stays there and re-educates the gut microbiome?
Retrains your whole immune system.
Got it.
Yeah, it retrains your whole immune system. You end up with a good immune system. Now, they're also using that to increase their success rate with chemotherapy, and they're also using it to take non-responders to chemotherapy. And there's some beautiful papers there on renal cancer and breast cancer where there are non-responders, and they turn them around to being responders by use of a fecal matter transplant. Now, they've actually done a lot of animal studies too, showing the mechanism for that. But obviously, you cannot train dendritic cells or your immune cells if they are not good cells to begin with.
Well, Mark, this has been a fantastic conversation. I feel like we can go on and on and on. We definitely went down a long path that started the oral mucosa and went all the way down the GI tract. So thank you for taking us on this wonderful ride. I can't wait to hear more from you. I'm sure that we will certainly hear from you in the future. And thank you for sharing your expertise. It's been wonderful. Thank you.
Yeah, thanks, Mark.
Thank you so much. I am sorry we didn't have time to talk about some of our research we're doing with prebiotics now. And
you know what? That sounds like part 2 then.
We got to do a part 2. Okay.
Absolutely. Absolutely. Part 2 coming right down. Hey, Raja, do you know where the integrative medicine movement started?
According to Google, since Google knows everything, Dr. Andrew Weil founded the Center for Integrative Medicine at the University of Arizona in Tucson back in 1994. Why do you ask?
Well, you know how we always try to get to the root cause? I think we need to go big for the 5th annual Integrative Dermatology Symposium. How about we do this? Let's meet at the Los Ventana Canyon Resort in Tucson, Arizona. Or you can join virtually from September 30th to October 2nd and hear from the world-renowned experts like Andrew Weil.
Exciting. And our theme is connecting mind, body, and spirit to take a more holistic approach to our patient care. What do you say?
Absolutely. I mean, where else can you get the latest on diet and dermatology, hypnosis, botanicals, common diseases, aesthetics, and other unique topics in dermatology with practical takeaways to start using in clinic right away?
So true. And let's not forget, we've got the new track for estheticians too. I think I'm going to need to call in a sick day or two before the symposium so I can enjoy the waterfall and trails on the resort, stargaze, play a round or two of golf or tennis, relax at the spa, and catch up with colleagues at the evening receptions.
Yes, that place is spectacular. You know, use our discount code POD25 at checkout for 25% off. That's POD25. Go to www.integrativedermatologysymposium.com. Come say hi and tag us on social if you'll be there at Integrative Derm Symposium. Now remember, clinicians of all backgrounds are welcome, and we sure hope to see you soon.